Hello, and welcome to Courageous Doctors, the new show for you and your doctor. On this show tonight, we'll cover Obamacare updates, other healthcare news, and health and safety tips. Now let's begin. VoxCare said that the CHIP funding, which, as you know, is the children's health insurance, actually ended October 1st. And of course, there's a lot of frustration in the Senate and the House to try to make sure the children still have their insurance package. Right now, states must send children to the exchanges or pay through Medicaid, and so we really hope that a common deal in the House is passed soon. Wall Street Journal says that the exchange enrollment that, just began again in November, this is the 5th year, subsidies are going to be funded, but the money is going to come from taking it away from one of the more expensive plans like the Silver plan and putting it into maybe a Bronze plan. These plans used to have lower deductibles, and people that didn't make a lot of money were like 400% of the poverty level or below, and they weren't eligible for Medicaid, but they still were making money at 400% poverty. They pretty much paid nothing for their premiums, but now there's going to be out-of-pocket expenses. There's going to be lower deductibles. It's not going to be as nice as it was because of the way President Trump changed it, but we still see that enrollment's going up and people are buying. I'll give you an example. At 40 years old, a person making $24,000, if he got a Bronze plan, it's fully paid. And the same with a 60-year-old man that was making $36,000, he could have a Bronze plan fully paid. All right, let's go to Politico. The emergency funds, as you all know, President declared an opioid crisis, but these emergency funds by the people that are actually treating these patients are telling us the money is not covering the full treatment and is not even covering the cost of naloxone, which is a life-saving drug that policemen are using to save these people overdosing on morphine or heroin, what have you. And so apparently the president says all this money's out there. I don't know what Governor Christie, who's his head man for the president that, led the whole country on this opioid emergency crisis, which is a national disaster. We have to meet it. But I don't know where all this money's going, and there has to be some transparency because the people that are treating these patients are saying none of the money went to them. CNN, this is interesting. Eric Hargan is now the new health and the new Secretary of Health and Human Service Secretary. He had served on the Trump's transition team, and as you know, Tom Price resigned with the scandal over flying too many airplanes or something. And so let's see what Eric Hargan's going to do in terms of trying to bridge the House and the Congress together, Senate and the House, with the White House on doing something with Obamacare and making it affordable. Fox News says that the premiums are going up on exchanges, and that's according to state commissioners. Each state has their own health commissioner, and they're in charge of making sure the plans are carried out. And these are staggering numbers. Tennessee, the exchange premiums are going up from 21 to 42%, and there's only one carrier in the state. Pennsylvania, it's going up 20%. Washington State, going up 20%. Oklahoma has one carrier. It's going up. Virginia's going up 60%. Prices in Florida up 45%. Mississippi 16%. So people, this is not a happy game changer here. We're all hurting for money. People that need these exchanges need a break. Hopefully the Bronze plan, they'll get some freedom there. But the rest of us that have to pay privately, this is not good. Now, this is interesting. The Washington Post said that half of the rural hospitals, I don't know if it's necessarily due to what's happening with Obamacare, but they're actually lacking obstetric services. So if you're out on a farm, you got a 50-50 chance of having a doc when you have a baby. Let's see. The Star Ledger says that Trump, as we said before, gave the executive order halting the federal payments for the cost-sharing reductions that went into the subsidies. But the Washington Post followed up on that and said this allows now health plans to sell more cheaper benefit packages, but with less services covered. So you got to know what you're getting. You may not get pregnancy covered. You may not get, other kind of illnesses covered, but you're going to get a cheaper plan, and you can sell across state lines as well. The New York Times, according to their recent census, according to the Census Bureau, the New York Times says that the uninsured in 2015 was 9.1%, and last year in 2016 it was 8.8%. So technically, Obamacare worked in getting the uninsured down. Now the Congressional Budget Office, I believe, and some oversight committees have said that with the changes, the uninsured rate might go up, especially since there's now there's a new effort in both Congress and the White House to do away with the mandatory having to sign up for Obamacare with a tax penalty, the individual plan. They had always put a hold on the employer's plan, but now even with the individual, which means people don't have to sign up. So Obamacare is going to have to work twice as hard to sell people, because now there's no tax penalty if this goes through. So we'll have to see what happens with these uninsured numbers. Washington Post said that due to the automatic re-enrollment and the fact that President Trump delayed the amount of time to go out and try to talk to people about signing up, and with people being automatically enrolled, this being the fifth year, people might get put on a plan now that is not the one they really need, especially since there's been a change in terms of how to get money to still pay for subsidies. And what if you get stuck with a silver plan and now you've got to pay everything out of pocket when you really wanted a bronze? Fox says that Medicaid uses 20% of the state's health care dollar, second to only the education, and just under 20% of the state's budget actually goes to health care, and out of that, Medicaid takes up 1/5 or 20%. So Medicaid is a big chunk of where our taxes go in the state, so this all has to be really worked out. And lastly, for Obamacare, the Washington Post said that Congress passes a law that weakens the DEA, the Drug Enforcement control over suspicious sales of narcotics. In other words, what the FDA always did and the DEA is if there was an opioid shipment and it didn't look kosher, quote unquote, they could go in and stop the shipment. And now, with some fancy maneuvering, Congress dealing with the lobbyists and the drug companies was able to pass through making all these opioid drugs without the FDA or the DEA really having any ability to stop these shipments. So we'll have to see. There's been hearings on that, and we'll have to see what happens. Let's move on to other healthcare news. CNN says that this is very scary. There's a plague in Madagascar. Now, there's always been mild cases of plague every year in Madagascar. We even have a few cases of plague in our out west. In western United States, they crop up now and then out in the mountain areas. This is the same plague that, of course, devastated Europe for hundreds of years, starting in, the mid-14th century, wiped out half of Europe. And every 10 or 15 years after that, minor plagues came. The plague that was passed, by the fleas of rats. So as they went in shipping routes and people carried the clothing or the grains infected with these fleas from the rodents, the plague would spread and kill people. It has a very high mortality rate. Fortunately now, with medication, if it's picked up early, it's treatable. And the plague, of course, comes in two forms. You're probably more familiar with the bubonic plague. That's where you have big lymph nodes, buboes on the body, and it doesn't kill you as fast as the pneumonic plague. The pneumonic plague is spread by pneumonia. It's spread by body fluids, and it'll kill you within a day, and it spreads quickly. So I think this was more pneumonic plague, but there was a little of both. But the difference this time in Madagascar, and unlike in our own country, in sporadic areas around the country where we occasionally get this deadly ancient plague, the difference is it happened more close to an urban area, so there was more spread. But World Health is on top of this. Doctors Without Borders, everybody's on top of this, and they have CDC has teams in there, and supposedly it's getting under control. But that was the big scare. Continuing on with worldwide epidemics, cholera in Yemen is still tremendously out of control. I don't, obviously it's due to a war zone. People can't get in there without being shot to help people. They have been unable to get the vaccines in there, but 1 million people infected with many, many deaths. Cholera is still here, everybody. I remember when I went to the Philippines back in the 70s, I had to get a cholera shot, very painful shot. You don't see people getting cholera shots too much, but cholera, I think, was in Haiti after they were devastated by hurricanes. These diseases don't go anywhere, you guys. They keep cropping up. Fox News says that we have West Nile virus back again. It comes, during hopefully goes away when the mosquitoes die. It's mosquito-driven. But it killed 7 people in the Los Angeles County and 100 people infected. So, that you'd think it's cold. Hopefully it'll go away. But these mosquito diseases, dengue fever, Zika, with giving birth defects and causing some Guillain-Barré, chikungunya fever, and West Nile virus. These things are with us. Fox News says that we had another death from Legionnaire's disease in Queens due to contaminated apartment plumbing. And look, even if you get it fast, 1 out of 10 people with Legionnaire's, it can die. It spreads through the ventilation system. Legionnaire's is an organism that lives in contaminated air conditioning and plumbing units in these big water towers and things. You get it in ships and wherever you have a huge ventilation system. And we've seen this several times. We've reported on it right here on Courageous Docs that New York is having these sporadic epidemics. And hopefully most of these people live, but 1 out of 10 still die. So something, the New York government, the city government is trying to do a better job inspecting these contaminated water towers, but they got to get to them before they kill more people. Fox News says that people that were exposed in the floods, these horrific 100-year floods like we had in Texas, Hurricane Irma, that brain-killing amoeba that we've often talked about here. I think in the past we reported kids swimming in a river in North Carolina. You kick up the dust in the bottom of the lake, and that's where these amoebas live, and these Naegleria amoebas, they're parasites. And then they when you breathe in the dirt in the lake or the still water wherever you are, it crawls in, it gets the water in your nose, carries the amoeba, it goes to your brain and kills you. So these are scary, and they're noticing it after Hurricane Irma in Texas. So people have to be careful if they're washing their face or using nasal solutions, or they're in dirty water from the hurricanes. They got to wash their hands and not let the water get in their nose. MRSA was also found. The resistant staph was also found in shelters where people were living from the hurricane. This is very scary. The LA Times reported there's been a massive hepatitis A outbreak all across the West, I believe Minnesota. Hundreds and hundreds of people in each state, and 10 or 20 people dead from it. And hepatitis A is an interesting virus. We always think about it as bad shellfish or clams, and you get sick like a mono for a month or two. But when you have these massive epidemics with a very aggressive strain, it can kill you. 20 people out of 400, this is modern day America. That's a pretty high number. So there's a massive attempt to vaccinate people in these states, and we should all be on the lookout. The hepatitis A shot is given to children, and so hopefully they'll be protected, but it's mainly the adults that probably never got the shots. So this is something to keep your eye out. And unfortunately, hand sanitizers don't kill the hepatitis A. You have to wash your hands. And the hepatitis A can live on surfaces for months without dying, and that's pretty scary. But this is the plain old common hepatitis A food poisoning we always talked about, but it's spreading massively. More salmonella outbreaks. Fox News tells us, please be careful if you I know some friends that have chickens in their backyard, ducks, things like that. You shouldn't be kissing them. If you get them on your shoes, make sure you clean your shoes before you come in, all the poop and everything. And make sure you wash your hands before you eat, because these chickens, they carry salmonella. There's been a salmonella outbreak, according to CNN, from jambalaya. I've never tasted this. Apparently, it's a popular Louisiana dish made with chicken, sausage, vegetable, rice, and seafood, but it's contaminated with salmonella. There's been a salmonella outbreak from Mexican Maridol papayas. Cases in 26 states now, 235 sickened, 70 hospitalized, and 2 dead. The majority of the cases are in New York, New Jersey, California, Virginia, and Texas. Boy, oh boy. And that was the contaminated papayas. Fox News says that swine flu has broken out again at some fairs. This one, Maryland State Fair. Sick pigs. I believe the pigs were treated. I don't think that children or people were actually contaminated. We've reported these stories many times at these fairs. Please, when you touch these animals, wash your hands if you have kids. These petting zoos are wonderful, but these animals are sick, so be careful. Oh boy, this is bad. Fox News, botulism was contaminated and recalled in something called Death Wish Cold Brew Coffee. What a name, huh? Botulism, a killer poison, and the name of the product is Death Wish Cold Brew Coffee. It's the 11-ounce nitro cold brew cans. CNN has reported an increase in your sexually transmitted diseases, chlamydia, gonorrhea, syphilis. In fact, the American Academy of Pediatrics has asked us as pediatricians to, in any sexually active teenager, to make sure we get a urine for chlamydia and gonorrhea at least once a year. Some of us forget to do that. Fox News says there's a new test for Alzheimer's disease published in the National Academy of Sciences. It's very interesting. They've discovered some kind of protein associated with the Alzheimer's, and maybe if they pick it up earlier, they can do treatments earlier. So that's always exciting news. The Mayo Clinic has, according to CNN, a new class of drugs called, this is interesting, senolytics, like seniorlytics. It reverses the aging process by actually killing aging cells. Apparently, one of the reasons why our body cells, why our body ages, is not only a shortening of what we call telomeres, which are part of the chromosome in us, but the cells themselves age and get packed with all kinds of junk, and they end up, we're living with junk in our body, and it's not cleared out. So these drugs help our body clear out the aging cells faster to keep us younger. It's very exciting. CNN reports that Japan has altered chicken eggs to grow interferon. Why is this important? Interferon is very expensive. So if they can grow it cheaply in eggs, interferon is a cell signaling messenger that not only helps the body fight viruses, but also is used in autoimmune diseases like multiple sclerosis. So if we can produce this more cheaply and get it out in greater quantity, it'd certainly be helpful. The Washington Post says, and this is always fascinating, gene therapy is now used to treat rare inherited diseases. One is a form of blindness. Apparently, the gene makes a protein needed for vision. Genes are used for, we'll report this from time to time, genes are being used to replace enzymes lost. There's the new gene splitting process called that CRISPR, C-R-I-S-P. We've mentioned that before, where you can actually take out a defective part of the gene and replace it with the good one. They're even doing it in embryos and reimplant it in mommy so that the person's never born with the disease, the baby. But they're even taking people's cells with cancer out. They're taking their lymphocytes, their immune cells out, recoding them with these gene products to now fight the cancer cells. So these are all exciting biotech firms. I'm sure will give you everything, but we will report these time to time. But there's exciting things going on with gene therapy and the ability to fight cancer, fight autoimmune disease, stem cell research, Parkinson's, dealing with various forms of macular degeneration and blindness. stem cells to grow, the Army's paying for research for our vets that were hurt to grow new limbs and things. So these are all exciting things. This is interesting. Science Magazine says that research at Bristol and University of Oxford found a chemical to prevent bacterial resistance to commonly used drugs that we use, which we call cephalosporins or beta-lactams. Basically, the bacteria has found a way to break down our drug before it can kill it. So the research here is to put a chemical in with the drug that prevents the bacteria from breaking the drug down. The World Health, as a follow-up to that, the World Health Organization says that we have 2 million resistant infections each year that kill 20,000 people. And of course, the main concerns: tuberculosis, Acinetobacter, Pseudomonas, Enterobacter. So we need to really fight resistance. Right now, there's 51 new antibiotics and 11 new biologicals, but that's nowhere near what we need. So we really need to tackle the resistance to drugs. The ABC News mentioned that we now have another shingles vaccine. This is very important. The key is the vaccine we've all been using, you were able to take when you're over 50, but apparently it doesn't have as good of effect as the one now that you can't take until you're 60. So some people may want to retake the shot. My warning to you would be that these shots, make sure you really need it. Get a blood titer and see if you're immune to chickenpox or shingles, varicella virus. Because if you still have a high level and you take the shot, you might get a super immune response, and it can be devastating. So just if you've had the first shingles shot, like a lot of us did, I had mine in my late 50s, I'm not going to run and take this second shot. I would get a blood test first and see if I'm immune. If I'm immune, why would I want to take another shot? But the author of this article did say that we should all know that a third of all of us that had chickenpox as kids are likely to go on and get shingles if we don't get the shot. And shingles is horrible. But just make sure if you've had the shot that you get tested before you get another. The Washington Post said that researchers discovered a biomarker for chronic traumatic encephalopathy. You know, that's the big news with the football players. That's all the stuff about concussions, where we're always worried about kids being hit in the head and pros being hit in the head, like we used to worry about boxers. And now they've actually found a marker, some kind of protein disruption in the brain that they can pick up. So they might be able to tell if an athlete had this chronic traumatic abuse to their brain, encephalopathy, and whether they're going to need earlier treatment. Because up until now, it was only at the time of autopsy where you dissected the brain, you saw changes of football players being hit in the head a lot, but now they've got a marker. The New York Times reports on a plant-based diet that is as effective as what we call PPIs, protein pump inhibitors, we all take for our acid indigestion. And this is very exciting. It treats the acid reflux, especially reflux that goes up to your throat and chokes you, and I know that one well. And it does it by using alkaline water and the Mediterranean diet. So if for all of you who are like me have lived on protein pump inhibitors or we can't eat for many, many years, maybe alkaline water and the Mediterranean diet is the way to go. Check it out. It was in the New York Times. Very interesting.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Berry in a professional and personal capacity for many years, and we are thrilled to be in his building. We are psychotherapists and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
Our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
All right, let's move on now to health and safety tips. Fox News warns that caffeine-like effects are still found in something called guarana, cola nuts, and yerba mates. So all these fancy drinks that you get in these fancy coffee stores and all, realize you may be drinking very concentrated, dangerous levels of caffeine. We've reported this many times before. Remember that you really shouldn't, you should be, first of all, not young children. You should be already adults or older teenagers. If you're drinking coffee, never more than equivalent to 4 cups a day. And many of these power energy drinks, you can get even more than that in one little shot glass. And even, you have to just be careful. Even these fancy latte drinks and all that you find, you have to really be careful. So this is just a warning, guarana, cola nuts, yerba mates. Just be careful where your caffeine's coming from. This is interesting. CNN reports, who would think about a store cleaning our fruit and vegetables before they sell it to us? I mean, we all go out and buy fresh fruits and vegetables, but these have a lot of pesticides on them. And even on organic farms where they're not supposed to have pesticides, who knows how well it's really cleaned. So what they say is, even though the store is cleaning it with bleach, you may want to try using baking soda at home, 2 teaspoons of baking soda to 2 cups of water, and you'll get more pesticide off your fruit than the store will with bleach. So it's interesting, something to think about. CNN says that now there's 5 more kinds of phthalates that are banned by the U.S. Consumer Product Safety Commission, and bringing the total up to 8 since 2013. This all stemmed from, if you remember, the Consumer Product Safety Improvement Act. Remember, these are chemicals found in plastic water bottles, shampoos, and flooring, and even in fast food wrappers. We reported on that last time. And they're banned, of course, in baby toys. This is where they say, don't drink water in plastic bottles, you get phthalates. Well, they're more and more, we all do that anyway. I mean, we all drink bottled water. But they're just saying, be careful that, especially with little kids, that 5 more kinds have been banned. CNN says that there's a cancer cluster, and this is interesting. There's a police station in Cincinnati that lived near a toxic lake and was spilling all sort of pesticides and asbestos and what have you. And somehow that got into the police station, and over the years, officers began dying of cancer. So it's just another thing to add to our horror stories about being poisoned. NPR said be careful when you're looking at the labels that BPA, which is bisphenol, if it says BPA free, which is another kind of like phthalates you find in plastics, it may have something called BPS, which is similar to BPA. So by law, if they say BPA free with no bisphenols, that just means there's no BPA, but there could be BPS, which is a different kind of bisphenol. So again, we're being screwed and lied to and misled, and it's all legal because all these things are done within the law. You just have to be careful and be a smart consumer. USA Today says that 94% of the United States tap water contains plastic fibers coming from washing machines, dryers, clothes, upholstery, carpets. Great. So now we're drinking our clothing. That's just wonderful. Another thing, help you feel warm on a cold day. Your stomach feel warm. Your clothing's in your stomach. Time magazine, tattoo ink particles can get into your lymph nodes. Tattooing on your body, into your lymph nodes, into your body. I don't know what that's going to cause, but I don't want to find out. Reuters says that the hypoallergenic fragrance-free moisturizers may still contain irritating chemicals. Reported in Journal of American Medical Association and Dermatology, only 12% of 174 of the most popular brands that were hypoallergenic were free of allergens. Wonderful. I can't tell you how many times in my office, and the mothers are totally surprised. Their teenage daughters come in with Lord knows what, with crazy rashes and scarring and everything. And it's from these cosmetic products, hair products especially, but even the others. They're just allergic to some of these chemicals they put in there. So be careful. Look at the consumer product safety guides and see what's in there, you guys, before you start doing it. The Milwaukee Journal Sentinel says the CDC research on coffee roasters found 10 out of 49 air samples exceeded safe limits of diacetyl, which causes lung damage. So for all you coffee roaster lovers, you have, it looks like, a 25% chance, 20%, 10 out of 50, 20% chance of destroying your lungs. Lovely. Fox News, there's a recall on Delta Children Jeep brand strollers, which is used for jogging because there's a risk that if they fall over, they'll break and hurt your child. Fox says Playtex has recalled children's plates and bowls because they're choking on the plastic. Yikes. Fox says the toddler that suffered second-degree burns, this is interesting from a pacifier clip. I don't remember if I reported this last time. The clip, a clip that holds your pacifier, the child was hot in the sun, and the clip stuck to her skin from her body heat and burned through her skin. Oh boy. Star Ledger reports 7 deaths from babies sharing a bed with adults in Essex County, and they said the county sees 2 deaths a month. Boppy pillows are a big problem that are used for the babies. Babies should be sleeping on their backs alone with a firm mattress and nothing else in bed. This is crib death, you guys. This is what we call crib death, sudden infant death syndrome. And just be careful. Bloomberg News says that Medtronic is a big tech company that makes insulin pumps and things, arrhythmia stuff, pacemakers, all sort of stuff. Their diabetes infusion sets have been recalled, which were used for insulin pumps because they were triggering excessive doses. That's not good. CNN said, careful with certain spices if you're on blood thinners. This is interesting. I didn't necessarily know this. If you're taking blood thinners, because, you have a valve in your heart or you had blood clots or something. If you're taking blood thinners, be careful of rosemary, dry ginger, garlic, thyme, oregano, and Chinese cinnamon, which actually has coumarin, a blood thinner, in it. I did not know that. And lastly, CNN says our favorite holiday dessert, chocolate. Dark chocolate, of course, is better, has less fat and sugar. White chocolate has the worst because the more cacao that you have, the less fat, the better. So they said make sure you have at least 60% cacao in your dark chocolate. And why aren't you 100% cacao in your dark chocolate? Because apparently it is so bitter that people will dilute it in manufacturing processing to get out the bitter taste. So make sure when they dilute it, you've got at least 60%. The dark chocolate has its flavanols, which are anti-inflammatory. So they not only have less sugar and fat, they're anti-inflammatory. And if you have 60%, you're going to get that. It also, dark chocolate has calcium, magnesium, iron, phosphorus, potassium, zinc, but limit yourself to only 1 ounce daily, which has 150 calories. I want to thank you all once again for enjoying a wonderful time with our news show. As always, if you have any interesting comments, please send them in and we'll share it. And I want to wish everybody, if you're seeing this before Thanksgiving, a happy holiday, or at least before Christmas, a happy holiday season.